In this episode of Medicine Across a Lifetime, let me start with a story that shaped the way I practice medicine today. I remember my first week on call as a young resident, walking into a room of a patient who had been seeing doctors for decades. While I reviewed the charts, it became clear that the textbooks and protocols could not replace understanding the patient's story, the subtle shifts in their condition over time, and the patterns that only a seasoned clinician would notice. That moment taught me that medicine is not just about knowledge, it is about the wisdom accumulated over a career. Medicine across a lifetime is a journey, not a checklist. It is about continuous learning, adapting to new evidence, and passing knowledge on to the next generation. It is about asking the difficult questions: how do we balance evidence-based guidelines with the nuanced judgment that only experience can provide? How do we ensure the lessons we learn are not lost as physicians retire or move on? These are the questions that define the legacy of a medical career. One of the most rewarding parts of practicing medicine is mentorship. Guiding residents and young physicians is not simply about teaching procedures. It is about teaching judgment, ethics, and empathy. I have seen young doctors face difficult decisions where no textbook could provide an answer, and having a mentor to guide them made all the difference. Legacy knowledge is not written in charts or research papers, it lives in the conversations, the reflections, and the shared experiences of clinicians. Mistakes are inevitable, and they are often the best teachers. Early in my career, I misdiagnosed a patient's condition, and it could have led to serious consequences. Sharing that experience openly with colleagues turned it into a teaching moment. Failures are not a mark of weakness, they are an opportunity to reflect, learn, and improve. This honesty builds trust and strengthens teams, creating a culture where experience is valued and passed along. Medicine is constantly evolving. Technologies like artificial intelligence, innovative therapeutics, and advanced diagnostics have transformed the way we practice. Yet, the core of our work, listening to patients, understanding context, and applying thoughtful judgment, remains constant. How do we integrate these new tools without losing the human touch that defines our profession? By combining innovation with experience, we ensure that technology enhances care without replacing the wisdom that only comes from years of practice. Statistics show that experienced physicians often detect subtle patterns that less experienced clinicians or even some artificial intelligence tools may overlook. Mentorship improves patient outcomes and preserves institutional knowledge. However, pitfalls remain. Over-reliance on technology, insufficient mentoring, and rigid adherence to protocols can erode clinical intuition and compromise patient care. Recognizing these challenges is crucial for sustaining quality over decades. Ethical and practical considerations are central to this conversation. How do we honor patient autonomy while maintaining clinical responsibility? How do we navigate legal risks while applying judgment built over decades? The answers are not always simple, but reflection, mentoring, and professional networks provide guidance. Sharing stories, lessons, and reflections ensures that wisdom does not end with a single career. Step by step, physicians can preserve and pass on legacy knowledge. Document important lessons, mentor actively, integrate new evidence thoughtfully, and cultivate reflective practice. Utilize tools such as case conferences, longitudinal patient records, and professional networks to reinforce learning. Measure success not only through outcomes but through the growth of the next generation of physicians. Looking to the future, medicine across a lifetime is not just about individual growth. It is about shaping the profession. Future physicians will inherit our successes, our failures, and the wisdom we have accumulated. By capturing and sharing this knowledge, we ensure that patients receive better care, teams are stronger, and medicine continues to evolve responsibly. I want to leave you with something actionable. Reflect on one lesson from your career that could help a younger colleague. Share it in your department, with your network, or in a teaching session. Ask yourself, what knowledge could prevent someone else from making the same mistake? This is how legacy knowledge is preserved and multiplied. I also want to hear from you. What has been the most important lesson in your medical career so far? Leave a comment, share your story, and forward this episode to colleagues. Let us start a conversation about how our experiences shape the future of healthcare. If this episode resonates with you, take the next step, mentor someone, reflect on your practice, or contribute to a professional discussion. Be part of preserving wisdom, shaping the next generation, and making medicine across a lifetime a shared journey rather than an individual path. How will you pass your knowledge forward? Share your thoughts in the comments, discuss with a colleague, and share this episode to expand the conversation. Step into the legacy of medicine and make your experience count.